Administrative decentralization is one type of decentralization. It means that we're making decisions for healthcare away from Putrajaya and towards Kota Kinabalu, towards Kuching, towards Kuantan, and so on. It is not intrinsically better or worse than centralization. Decentralization is on a spectrum. And because it's on a spectrum, it is not all or nothing. Some parts of healthcare should be decentralized and some parts should remain centralized. But I arrived at the conclusion that in Malaysia, the system will benefit from more decentralization because the system is currently heavily centralized, but there is inequity. For example, Sabah has got fewer doctors, nurses, beds, hospital beds, CT scans and MRIs compared to the rest of Malaysia. So health outcomes are a little, or rather very unequal around Malaysia. Number 4, accompanied by capacity building, at least in 2 ways. You cannot just decentralize without giving capacity and ability for the people in the subnational governments, like state governments or district councils, to do the work. This must be accompanied by accountability. What this means is you cannot just tell them to be responsible for healthcare and give them money for them to manage without strengthening the Auditor General or oversight committees in Parliament. One important component for decentralization is to resolve a built-in conflict of interest within the Ministry of Health. Ministry of Health in Malaysia today, they're playing 3 roles at the same time. They're setting the standards and they're regulating and they're providing services and they're paying for these services. And finally, decentralization of public healthcare services is not as simple as we just give it to state governments, because the hospitals and clinics of Malaysia have been run for a long period of time through the central federal government. And maybe what we need to consider is a hybrid decentralization model. For example, a corporatized entity that delivers healthcare services, but receive coordination and oversight and governance and also resources or money from federal and subnational governments.
Can it be done? Yes, it can be done. Article 76A of the Federal Constitution allows Parliament to empower the state government of Sabah and Sarawak to pass laws to create a separate health authority. 76A is always a good avenue if the federal government is agreeable to basically decentralize and give you substantive decentralization. Will it happen? It's really up to the politicians.